Hello, everyone. I am Sara Dzimianski, the Ag and Natural Resources Educator here in Perry County, and I'd like to welcome you to our January 2023 webinar. One thing to know is that for 2023, we are going to be moving to a quarterly webinar. And so, and we're going to start that with our February webinar is going to be our first quarter webinar. And so then we will be offering these webinars quarterly for 2023. And for those of you who don't know me, I spent over 20 years, raising, showing, breeding registered dairy goats. I did get out of goats last year due to some personal reasons, but I have a lot of experience in managing, kiddings with goats. And with me today is Robby Kelly, and I will let him introduce himself and he will get us started on our presentation. So welcome, Robby.
Thanks, Sara, and good afternoon to everyone that's joining us, whether you're live or going to watch our recording. Appreciate your time today to learn a little bit more about management for kidding and lambing. So I've been an extension educator about 10 years here in Elkhart County in the northern part of our state. Personally been raising boar goats for over 20 years. Lots of family experience as well in the boar goat, as well as showing some lambs. So have a little bit of varied experience here. So hopefully to share a little bit with you about kidding and lambing today that can help you in your operation. So one of the things that we're going to kind of touch base on, and some of this may be very basic for some people, is a good reminder. Some of this may be new information. So as we're going through today, feel free to put questions in the chat. We'll get to those. Or at the end, will be our contact information to reach out to either Sara or I, or even your local extension educator we can get you connected to as well. First topic I want to kind of talk about a little bit is about barn preparation. Now, this is going to depend on your operation, whether you're kidding in the field or lambing in the field versus in your barn. Either one is acceptable, just depends on the time of year, especially here in northern Indiana. We like to use the barn to do most of this stuff since we got about 4 inches of snow on the ground right now. So one of the things I want to talk about, barn safety is really important, not just for you as a human, but your animals as well. Barn accidents are common and can really be prevented with just a simple review of your surroundings. So extension cords are the big thing. If you use heat lamps, you have heated buckets, those kinds of things. Making sure you have extension cords out of reach of animals, grounded, if you have GFI outlets in your barn, and making sure not too many things are plugged in and overloading your electrical circuits. It's really scary to think about barn fires, but some of those we can prevent by making sure we just kind of do a quick safety check, keeping your aisles clear throughout your entire barn, hay mangers and feeders put up properly. That's a big one, especially if you have little lambs or kids running around, making sure they're secure so that there's no accidents there that could, accidentally fall on the animal and hurt the animal, those sorts of things. Feed is properly stored in water heaters. Sometimes people like to use heated buckets or those kinds of things. You can buy what they call thermo cubes that kick on at a certain temperature. So if you don't like busting water in the middle of winter, that's a good thing to use. Just a quick note on some heat lamps. One of my 4-H club leaders posted this the other day on her Facebook page that they had a heat lamp that had burnt some of their wood in their barn, and thankfully they caught it in time and there was no fire. So this is our number one source of a barn fire, and this is why I always tell people, if you're using heat lamps, to be super careful. By no means do you need to use a heat lamp. I personally do not use a heat lamp unless it is like -10 outside and the barn gets really, really cold, and I'm kidding at that time. So there's ways to prevent those. So making sure your animals can't get burnt or chew on cords, you have them secured properly and they're hung up so that they don't come in contact with the bedding. And you can look for brands that have fail-safe cords in them. They are out there on the market. They are a little bit more expensive than the traditional metal ones we think of you can buy in a farm store, but they are well worth the investment if you're looking at using a heat lamp, especially if you're kidding there or lambing in the winter time. One of the things about thinking about your barn, if you are birthing in your barn, or if you're birthing out on pasture, this is kind of geared more towards a winter type of thing. Since here in the Midwest, we typically we're crazy and kid and lamb in the winter sometimes, especially if you're in that 4-H or producing for those kinds of things versus a commercial producer. But a lot of this is applicable to the commercial producer as well. Birthing pen needs to be a clean, safe space for that lamb or that goat. If your kidding and lambing occurs in warm months, a small grassy paddock is sufficient. So if you're March, April, May, June, if you're birthing outside, there's great spaces for that. Just making sure it's a clean, dry area is the big thing. During cold months, indoor space is probably the best to protect from the wind and precipitation. That way, the young kids aren't getting sick, those kinds of things. And good ventilation is really important. And that's sometimes we forget about in the winter months, is having good ventilation in our barns, especially during those seasons, because we need to make sure that the ammonia level is not too high. The pens that you build, if you're doing the pen route, need to be big enough for that doe or ewe to lay down without touching both ends and getting up. Typically 4x5 or 6x6, depending on the size of your animal. Just enough for them to have some room and for them to give some birth and be able to the kids to also move around and about. Openings in penning material can be approximately sized, so making sure you have a big enough gateway to get through there. I know I've got some large goats that sometimes I need a bigger door for them to get through because they're a little too big. Feed and water containers should be placed where ewe or doe cannot drop kids and lambs into them while giving birth. I think this is important too, because sometimes those animals like to move around the pen. Just making sure that those kids or lambs can get safely to the ground, and they're not getting obstructed by any of the feeders or waterers. One of the things we want to think about is bedding choices. Everyone has their own personal preference for this. The big thing for me for birthing pens or birthing areas, if you're doing it out in a pasture, is there needs to be a clean, dry place for that animal to lamb or kid. So clean straw, a clean grassy area, clean old blankets or newspapers work well. My preference is straw or old towels. If you're in a barn setting, making sure it's clean and dry. That's the big thing with lambing or kidding. And then poor choices of bedding, sometimes sawdust because it sticks to everywhere and it can get in different places. Bare soil, dirty straw or manure pack. So the big thing is you got to think about, you have your lamb coming out or you have your kid coming out and, brand new to the world, not a lot of immune system. Those big things, can help introduce infection. So having that clear or clean area is really important for our animals to have. So just some supplies to have on hand as you're preparing for kidding and lambing. Now, this is not an all-inclusive list. This is just some things that Sara and I came up with to have on here. And so we'll go through those here in just a second. So some of the things as you think about your birthing kits or your kidding supplies, they don't have to be fancy by any means. In my barn, I have 2 big totes full of just stuff that I like to keep around. So cleaning towels. So I call this my wife's good excuse to get new towels for our house. So old bath towels work really well, or cleaning towels that are old and have outlived their purpose of the house work really well to help you dry off kids. Betadine or chloroxidine for cleaning up mom and dipping navels. Something to have on hand. Exam gloves. So if you have to go into mom, those kinds of things, you have those things there. Lube in case you need to go in and examine mom as well. A flashlight or headlamp. Been in lots of barns that don't have uber great lighting, or if you need to kind of see what's going on, that's a good thing to have. Injectable oxytocin. is a good thing to have on hand as well. That is a vet prescription. And depending on what your vet recommends, we typically use this to treat retained placentas or stalled labor. It's just something that you should be able to readily have available if needed and recommended by your veterinarian. A hemostat or an umbilical clamp. Sometimes if you've been in the business long enough, lambing or kidding, sometimes you get the umbilical cord that's too long and you need to tie that up or get that cut off there. You can also use puppy training pads that you can buy at the store. It's just a disposable, clean, and absorbent area that you can quickly toss and throw away. I don't use those personally. Typically what I do is I just put fresh straw down and then just take the straw out after we're done with the whole process. Of course, that's thinking about the kids. We got to think about mom too. One of the things that we sometimes run into is ketosis could be a problem with your animals. So having some ketone strips in case you need to kind of diagnose what's going on. Propylene glycol, which is a treatment for ketosis. It's a good energy booster as well. Nutri-drenched molasses or Karo syrup. I think you'd be surprised the amount of things you can find in your kitchen. We always have Karo syrup for baking, and sometimes you have to use it for the goats as well. Or Tums can be used for calcium deficiency. Needles and syringes, a dosing syringe without needles, and a phone number for your veterinarian in case of emergency. I always think that it's really important to have those to think about. And so before I turn it back over to Sarah to cover the rest of this section, we do have a question here that says, I'm very new to experience for our first kidding, but why do you need a cord clamp? Do they not chew it themselves? Are these animals not good mothers to where they only need minimal intervention? So for that, most of the time, once in a great while, I've had to use a cord clamp. Most of the time, the mom will do that or it'll detach. But sometimes when you get one that is, can't really see it in my background, super long, more than 3-4 inches. At that point, you probably want to shorten it just a little bit so it doesn't get ripped off.
Hey, Robbie, I'll address that question as well. Sometimes you have does that are aggressive cleaners when it comes to cleaning up the kids, and they will actually bite the cord off right at the body wall. And so then you actually end up with an opening into the body wall. And so you need to have some things on hand to address that when you have a doe that's a really aggressive cleaner, or a ewe that's a really aggressive cleaner. And so that is the main reason to have a cord clamp on hand. And so, yeah, in general, you want the thing is, yes, most of the time they will do just fine on their own. And, a lot of our hair sheep producers are moving to, lambing out in the pasture with little to no intervention. And ideally you want little to no intervention. And the amount of intervention that you might be prepared for will depend on your type of operation. And again, a lot of it depends on the body condition score. We'll talk about this of the ewes or the does coming into lambing. Are these show animals? Are these commercial animals? Are you looking at sheep that are being extensively managed and expected, to survive out in the pasture and take care of their own kids? And so there are a lot of factors that go into this, but it is good to have these things on hand for emergency situations. 95+% of the time, you won't need any of these things. These are more things that you just want to have on hand as an emergency kit. Next slide, please, Robbie.
This one we didn't cover, so this one would be
okay. We'll cover this one. Yeah, so as far as we can talk in detail about each of these, so like a lamb or a kid tube feeding kit, that's something, again, if you have a weak lamb or kid, and in some cases, again, in the example of an extensively managed hair sheep operation, this may be something where you don't necessarily want to intervene. You may let nature take its course, as cruel as that may sound, but it may be something where you don't want to perhaps weak genetics in your flock. But if you are doing a more managed operation, more intensive operation, then you will have times where you have a weak lamb or kid, and sometimes just getting some calories into them is all they need to get a jump start. And so that's where the tube feeding kit comes in. Pritchard nipples are a little bit easier than a standard nipple for a neonate to grasp. And so that's the reason why you would have Pritchard nipples, and they just screw onto an empty soda bottle. Colostrum, I think, is important to have. And you can either use colostrum replacer that you purchase, at a farm store, or you could save colostrum from your herd or flock from the previous year. It will keep, for over a year in the freezer. And so your best bet is to take a CAE or OPP negative, doe or ewe, and it's particularly one that's older, because older does and ewes are going to have better quality colostrum in general, and one that's produced excess colostrum. So let her lambs or kids nurse first, and then milk the excess colostrum and freeze it for the following year. And then again, have milk or milk replacer on hand. That way, if for some reason you have a ewe or a doe who rejects her lambs or kids, then you're not having to run to the farm store at the last minute trying to find something, especially when they decide they're going to lamb or kid at 2 a.m., nothing's open, and you need to get something into these kids. Although colostrum is really what you want immediately, but you still, if there's going to be an emergency, it's going to happen at 2 a.m. on a weekend in general. I mean, that's just how things go. And then again, if you are lambing or kidding in cold weather, you need to have a way to warm chilled lambs and kids. And, again, most of the time, if they are bred to, lamb out on the pasture, they'll be fine. But if they get wet, so if they're lambing in rainy conditions, if the lambs get wet, then you can get some hypothermia. So be prepared to deal with hypothermia. And again, the bulb syringe, is handy to clear nasal passages, particularly if you have a breech birth, and we'll talk about that later. And then a rectal thermometer, again, this helps tell you, are they hypothermic? And then a stethoscope, if you have a weak lamb or kid, can you hear them breathing? Can you hear that heart beating? Okay, next slide, please. Okay, so let's talk about the countdown. So when you're lambing or kidding, it really helps to know the due date. And so first of all, with goats, you're looking at 150 days plus or minus 5. There are some slight differences depending on species and depending on breed. So do your research with your breed and with your species to know exactly what you want to expect. It really helps to keep accurate records of breeding dates. And so, in the case of show animals, most people are going to be using artificial insemination, or they're going to be hand breeding, because, you want to keep an accurate record of the sire and dam of every kid that's born on, or lamb that's born on the property. But in a commercial operation, you may be using pasture breeding, or maybe you have a show herd, but you only have one ram or one buck on the property. So in that case, you might consider using a marking harness if you are going to be pen breeding. And what a marking harness does is it has a crayon on it. And when the buck or the ram mounts the ewe or the doe, then he leaves a mark on her. And so as long as you are monitoring your herd or flock daily, like you're supposed to, then you can just write down what day you saw the mark on her as her breeding date. And again, if you are pen breeding, keep a record. When did you put that buck or ram into the herd or flock, and when did you remove him? Okay, you can go on to the next. And so how do you know if that breeding took? Well, there are pregnancy testing options out there. If you use biotracking or some of the similar blood tests, what these do is these don't tell you the number of fetuses, but they give you a yes, no. And again, you have to look at the instructions for each test. Typically, it's about 30 days post-breeding when they're accurate. There are some urine tests available for on-farm use, but they aren't accurate until later than the blood tests. And then also there are some laboratories that do milk tests. And so these are all options you can look at. There are also physical signs we can look for. So, I mean, the first thing that you're going to see is that estrus cycles will stop. And so sheep have a 13 to 19 day cycle, goats have an 18 to 21 day cycle typically. Again, there's variation between animals, between breeds, and just know your animals, know your herd, keep records of your individual animal. If the cycle doesn't appear in time, there's a good chance she's pregnant. It's not a guarantee she's pregnant, but it's a good chance, especially if you bred her earlier in the season. Some other physical signs of pregnancy we can see 60 to 90 days into gestation. So typically the first physical sign we'll see is we'll start to see the vulva soften and swell. And then, we'll start to see udder development. And in some, with some animals, it's not going to happen until shortly before lambing or kidding. With others, it will happen pretty early on in pregnancy. And so, a lot of times with your first time, doelings, they will be very tender in the udder area before you ever see any physical signs of udder enlargement. But just changes in their behavior, if you feel that area, can tell you whether or not they have an udder developing. Okay, next. If you really want some accurate information and you want to be able to count the number of fetuses, then consider ultrasounds or radiography. And so ideally, if you're going to do a transabdominal ultrasound, you want to do that between 35 and 90 days post-breeding for sheep, or between 40 and 75 days for goats. And then if you're going to use radiography, so that would be an X-ray, that would be 65 to 70 days post-breeding. And again, this is going to be most accurate if you have a veterinarian or a veterinary technician or somebody else who is a professional doing your ultrasounds or radiography. But there are some units that are inexpensive enough for you to purchase for on-farm use. You can purchase Pregtone units that are less expensive, but they are less accurate than a veterinary grade ultrasound, for instance. Okay, next. Okay, Robby, we'll turn it over to you for a little while.
All right. So some of the things we kind of need to think about, kind of making sure we're checking the health of our doe and our ewes that we need to think about. Some of this is given to us by a veterinarian. Your veterinarian may recommend something different. And so it's important to, again, have that relationship with a veterinarian that can be able to advise you more specifically on some vaccination protocols. One of the recommendations is to make sure you vaccinate with C, D, and T, which is Clostridium perfringens type C and D, which goats are typically very prone to, as well as tetanus. And so that's kind of your yearly time that you want to vaccinate for that. One of the things you also need to do is check your FAMANCHA score. And so those of you that may not be familiar with FAMANCHA, it is a scoring system where you're able to check the eyelids, under the eyelids for a possible worm load for your animals. And if they have a low FAMANCHA score, you want to make sure that you get to deworm them or give them some anthelmintics. And one of the big things you need to think about is making sure you don't use valbazen or another product that is not recommended to do so. So make sure to check your labels for that. Some people on the goat side of things like to use copper bolusing as a part of their health program. And so that's a good time to do that as well. And as well as, trimming feet, making sure you keep up on that. Kind of that 3 to 7 days before lambing or kidding, it's a good time to trim off that long hair or wool off the tails, hind legs, udders. And so especially particularly in lambs, making sure we have all those things taken care of. And again, if you didn't trim your feet before, depending on how your feet are, making sure that gets done. And then, if you have specific pens that you want to keep your animals in, Good to do that a couple weeks prior to. For me, it's just a really good way to monitor their feed intake and make sure they're doing A-okay. Someone asked if it's A-okay or if it's okay to do copper boluses closer to kidding. I don't have much experience with copper boluses. I don't have those types of things that I need to worry about in my herd. The best thing to ask would be your veterinarian, or if Sarah might be able to chime in on that as well. Okay, so some vaccination protocols to also think about. We kind of talked about those, the CD and Ts. Unvaccinated animals should have 2 doses prior to kidding or lambing 6 weeks before, and then 4 weeks before. If it's a previously vaccinated doe, 1 dose 4 to 6 weeks. Some herds will also have, it's not common, but can have problems with chlamydia. If you've had that diagnosed in your herd, veterinarians typically recommend 60 days before breeding and vaccinating 30 days later. And then also Campylobacter and bacterial pneumonia can also be an issue, primarily for use to prevent abortion. And you can vaccinate for that, about 60 to 90 days after you've given the first vaccination for breeding. And then bacterial pneumonia, some people vaccinate for that as well. And that, vaccinate, breeding, use, and repeat 2 to 4 weeks later, and then vaccinate again right prior to lambing. And then there's an article there that you can look up if you would like to. One of the other things I think is really important that we don't often factor in is our body condition scores, and it also depends upon what the goals of your operation are. Are you more of a show herd? Are you more of a production herd? And body condition is really something to take into consideration that you should really do prior to breeding, while you're managing them all the way through if they are bred, whether it's a goat or it's a lamb. And for this, you really need to do a hands-on physical evaluation, not just appearance. Especially with wool and hair can sometimes fool you on this. It's a simple scale from 1 to 5. An ideal body condition at birthing time is 3.5. So if you look over there on the right-hand side of the slide, we have somewhere with a little bit of fat cover, but yet we're not skinny. So the big thing with this, with body condition, you don't want to be breeding them if they're a 2 or a 1, and you don't want them going into lambing or kidding at a 2 or a 1, and you don't want them at a 4 or 5 either, because this is where we run into problems. Is if they're on that high or low end of the scale, we really want them at that 3.5 when they're going into kidding or lambing. So now it's time for some labor and getting into kind of the nuts and bolts of what labor is, and some different things you're going to run into. We're going to run through the stages of right before labor, what things look like, and then we're going to cover some issues that can come up as well that hopefully help you out here. And so, Sarah?
Okay, so let's go on. So before labor starts, the ewer doe is going to begin to show more signs. So we talked about the signs that you see of pregnancy, that the doe or ewe is pregnant. But we start to see these signs accelerate, and we start to see, them more obvious as we approach labor. Pre-labor can last a week or more. And so sometimes you're going to wonder, is this ewe or is this doe ever going to lamb or kid? But you will start to see the tail head raised, and you're going to see ligaments on either side of the tail head. Now, I've seen this happen a month before they've actually given birth. So just because you're seeing the tail head raised doesn't mean she's about to lamb or kid. But when you see those ligaments disappear, that's when you know it's close. So that happens about 24 hours before lambing or kidding. Okay, next. And so again, as we mentioned before, you may see udder development that starting early in pregnancy, but you're going to see some pretty drastic changes right before lambing or kidding. And so there will be some user dose, they will start filling weeks before they lamb or they kid. But you're going to see, you'll see a lot of udder tissue there. But while there are some that will put colostrum into their udder a week or more in advance. But a lot of them, you will just see them fill right overnight. So they'll go from kind of a fleshy udder to a full milky udder within a matter of hours. And so when you see that happen, you know that it's likely to happen soon. Others, they will just gradually build that colostrum. You may have some that are carrying around a gallon of colostrum for weeks. So it really, really depends on the individual. Okay, next. So stage 1 labor marks the beginning of the birthing process. And so the udder is, in most cases, is going to appear full and shiny. And again, this is not 100% of the time, especially sometimes you will have some of your first kidders that don't produce colostrum the way they should. Or you may have others that for one reason or another, whether it's stress or some other factor, they're not producing colostrum. But in most cases, the udder is going to become full and shiny. And so it's likely that labor has started. You'll see clear to slightly cloudy mucus from the discharge from the vulva. Again, this can start weeks before labor. But what this is the start of the cervical mucus that protected the fetus during pregnancy being expelled. You will also start to see mild contractions. Okay, next. And so when she's in stage 1 labor, you're going to see her get up and down. You're going to see her pawing at the bedding. You can see she's obviously uncomfortable. She'll often stargaze. She might bite at her side. But you'll just see she's just kind of miserable. You might hear her grunting and groaning. But again, you might hear this anytime during light pregnancy because, for those of us who have had our own children, you kind of know how that 3rd trimester is. And it's not any more pleasant for them. So typically early labor can last anywhere from 1 to 12 hours. If it lasts more than 12 hours, then you might want to think about contacting your veterinarian because there could be a potential problem. Next. And so let's watch this little video. And here's a ewe that is showing us some of the signs that we're looking for labor. So you see she's contracting, you see she's stargazing. See she's getting up. She's just not comfortable. So if she's pawing, they might head press sometimes, just different things to try to deal with the discomfort. Okay, so once we get to stage 2 labor, this is what we call active labor. That's when you're going to see a much thicker string of mucus. And what's happening there is the bulk of the mucus plug is being expelled from the cervix. And so this may happen in early labor, but typically you're going to see it at the start of active labor. And so you're going to see the ewe or the doe actively pushing. She may either be squatting or she may be lying down to give birth. She may go back and forth between lying down and standing and squatting. You're going to start to see the amniotic sac appearing. Typically, that's going to happen within about 30 minutes after the start of pushing. And again, if you don't see the amniotic sac and after the doe's been actively pushing for half an hour, that's when you might want to check on her because there may be something wrong. Okay, next slide. And so soon after you see the amniotic sac, you should see nose and feet shortly thereafter. There should not be a big gap between the time you see that amniotic sac appear and when you see nose or feet. And you want to see your lambs or kids coming within about half an hour of each other. And so if you have more than 2 hours from the time active pushing begins and there's no sign of the lamb or the kid, she probably is going to need assistance. Okay, next. So there are some different birthing positions that we could see in variations of normal. When we're talking about birthing conditions, we're talking about the position that the lamb or the kid is in. Normal presentation is the nose and 2 front feet appearing first. And in this case, she's not going to need any assistance unless you have a very large kid or a doe or a ewe with narrow hips. So if there's normal presentation, just leave it alone and she should be able to have it just fine. Again, unless there's a physical size problem on the case of either the lamb or kid or the doe or ewe. Next. So here's a short video. This shows a normal birth. This doe did not need assistance. I helped her out a little bit, but she did not actually need it. So you can see the amniotic sac appear. You can see there is a head and 2 front feet there. It's a nice, healthy kid. And so if you are going to assist, you want to make sure that when you do pull, you're pulling down towards the hocks. And so just some gentle traction. In this case, this was a yearling doe. It was her first time. And so just that little bit of extra traction just kind of helped move the shoulders through the birth canal because it was a small doe. So some other birthing positions we can see. A hind feet first presentation. This is a variation on normal. And in most cases, the lamb or kid can be born unassisted, but it's more difficult for the ewe or the doe than a normal presentation. So manually guiding can help smooth it out. And again, you're guiding down toward the hocks. You're never try to pull a lamb or kid straight back. You always want to make sure that, when you provide a little bit of traction, you're working with the contractions and you're pulling down toward the hocks. Next. Some other positions that we might see that, the ones that really don't need too much assistance, maybe some slight assistance, but not anything too difficult. A nose and 1 front leg. And so in general, you're going to treat this as a normal birth. And sometimes in the case of a very large lamb or kid, this may actually make it easier for the doe or the ewe to give birth. Hocks first, that's not an ideal position. What you want to do is you want to push it back in and pull the feet, pull the hind feet out first, because it's going to be a lot more difficult, to get the hocks without those hind feet first. And again, 2 back feet with dew claws down. So you have an upside down kid. In that case, you'll actually have to pull up just until you can get those hips through and then down toward the hocks as you would with a normal presentation. But again, it's not too difficult to manage. The ones that are more concerning, and actually with a lot of the positions on the left, those are ones that the ewe or the doe can probably have unassisted, but a little bit of assistance can just smooth it out a little bit. The ones where she's really going to need help, she's going to need assistance. A true breech. So that's where you have the tail first. In some cases, a lamb or a ewe or a doe that has wide hips would be able to have this lamb or kid without assistance, but it would be better to push the kid back, fish for the hind legs and bring it out hind feet first. If you have 2 front feet but no nose, that tells you that the head is back. And so that kid is not coming out until you get that head into position. So this is one where it absolutely requires intervention. So you have to push the kid back, you have to reposition. And so ideally you want somebody with small hands with gloves on. You need to have your fingernails covered. You don't want uterine tears, but you're going to have somebody with small hands put their hand in there, find the head, and guide the head into the birth canal. So you need at least a head and one leg to be able to get that kid out. If a doe or a ewe is having trouble, you're not seeing any legs, you're not seeing a nose come out, and you go in and check, and you feel a spine, there's no way that kid is coming out unless it's repositioned. And so in my experience, I've had one spine first that I've had to reposition. And so what happened was the kid was in normal position, but missed the birth canal. And so I actually had to turn the kid over in utero. I had to position the kid, turn the kid over, find the hind feet, and bring it out hind feet first with dew claws down. That kid survived. The doe survived. But it's not an easy position to manage. If you see, if there's a head but no front feet, in that case, you're going to need to go fishing for a front foot, because you're going to get a shoulder lock if you don't. Again, if you have a front and back foot coming at the same time, there's no way that kid's going to come out like that. And so you're going to need to reposition to get either front foot and head or two back feet. If you have feet from two different lambs or kids at the same time, you're going to need to push one back and make sure you only have one that's coming at a time. Okay, next. So some signs that there's a dystocia. So a dystocia is a big word for having trouble giving birth. So if there's been more than 12 hours after the start of stage 1 labor, if there's been more than 2 hours between the start of pushing and the time when she delivers, or more than 30 minutes in the appearance of the amniotic sac in the feet, so you see the amniotic sac, and it's been at least 30 minutes and there are no feet showing up. Or you see signs of distress, so excess blood. She's bleeding a lot more than she should. You're seeing her start to get really tired. She's just not showing she just doesn't have energy. You go in and check, and there's a malpresentation, one of these really bad positions. The head back, the head only, two kids at once, front and back foot, spine first example, or some different examples. Okay, next. So this is an example of a dystocia. So this was a yearling doe who the kid was coming normally, but he was very, very large. So she was carrying a single butt kid, and it was very difficult. He got stuck in her pelvis. And so she actually pushed for over 30 minutes trying to get this kid out. And so you can see I sped up the video just because she was just not making progress. Okay, looks like so eventually I had to provide traction and assist her. She was able to have that kid normally, but she needed traction. She needed that kid pulled. But again, when you manually reposition lambs or kids, the first thing you want to do is make sure that you are not going to tear that uterus with your fingernails. So make sure your fingernails are trimmed, and you also want to make sure that the feet of the kids are not going to tear the uterus. You want to make sure you use lubricant. Ideally, you have somebody with small hands doing the job. You want to make sure you wash your hands and then put on gloves. Again, those gloves are going to cover your fingernails, as well as protecting you from any zoonotic diseases that you or doe might have. So you're going to start with 2 fingers in the vagina, and you're going to gently work your entire hand into the birth canal. And first of all, feel to see how open the cervix is, and then gently feel what body parts of the lambs or kids are in the birth canal. So you want to feel for nostrils, feet, tail, or other parts to identify what is there. So if the lambs or kids are in the birth canal, you're not even going to feel the cervix. But if they're right behind it, then you may have a cervix that's partially open but not completely dilated. Okay, next. So if the head's back, you're going to, again, push the entire lamb or kid back into the uterus and find the nostrils. And then you want to try to get your hand behind the back of the skull and work the nose into the birth canal along with at least one foreleg. And then once the head is in the birth canal, you'll provide gentle traction each time the ewe or the doe, pushes. With the true breech, you want to push the lamb or the kid back into the uterus, work your hand gently down the hind legs, and gently maneuver the hind feet into the birth canal. Then you're going to use gentle traction to pull the lamb or kid toward the ewe or doe's hind feet each time there's a contraction. Next. Again, if you find the head only, you're going to push it back and gently fish for one leg. You'll cover the hoof with your hand as you move it into the birth canal to prevent uterine tears. And then once you have the head and one front foot in the birth canal, you'll provide gentle traction towards the ewe or doe's hind feet each time she pushes. If you feel two trying to come at once, determine which would be the easiest to deliver first, and then push the other back into the uterus. You're going to make sure that that lamb or kid is in a position where it can be delivered, and then deliver as normal. Okay, next. So how do you know when to call the vet? So if she's in pre-labor, if she's weak and lethargic and not responding to home treatment, or if she has excessive bleeding and you're not sure what to do about it. And again, she's shown stage 1 labor signs for more than 12 hours. And when you go in and feel, you're still feeling a closed cervix. So during or post-labor, during labor or after the labor, if you have a lamb or kid that's too big to be delivered, even with gentle assistance. So if you have tried to pull this lamb or kid and it just is not going anywhere, call your veterinarian. Or it's in a position that makes delivery impossible. Like you've tried repositioning, you just can't do it. Or the lamb or kid has a defect that makes delivery impossible. So early on in my time raising goats, in the first couple of years I was raising goats, there was a doe that was infected with Cache Valley virus. And she had a kid in utero that had frozen joints. And so that kid had to be delivered by cesarean because there was no way that kid would have made it through the birth canal with those frozen joints. And then if the doe is going into shock, absolutely call your veterinarian. Okay, next. So again, we have mentioned all of these things in earlier slides, but just make sure that you are wearing gloves, make sure that you move slowly, make sure that you are working with the contractions, make sure that you have both feet before pulling if you are doing one foot, or that you have control of the shoulder of the other side if you have one foot. Once the lamb or kid is out, make sure the water, the amniotic sac is away from its nose and that it's breathing. And then if you don't hear any noise, tickle the nose with a straw to get the lamb or the kid to take a breath. And then just back away, give some space so mom can come in and clean. Okay, next. So what happens if she needs a C-section? Most large animal veterinarians will perform a C-section on the farm. So you need to make sure that you have a clean, safe area where they can do this. They're going to need to have access to electricity. They're going to need to have access to clean water, and make sure you have plenty of clean, dry towels and a bulb syringe to suction noses, and then just follow their instructions. Next. Okay, so lambing and kidding is done. So what's next for mom? This is actually stage 3 of labor, because just because the lambs or kids have been born doesn't mean that she's done with labor. She still has to pass that placenta, and this should occur within 6 hours. And so if the birth was stressful, or you have a doe that just really seems exhausted, Giving her a dose of oxytocin can assist with passing the placenta. In most cases, you don't want to give oxytocin, in the earlier stages of labor, but oxytocin can be really useful, once she's in stage 3 labor. You want to make sure this is a prescription drug. Make sure you consult your veterinarian for correct administration and dosage. After 6 hours, you can potentially add weight to the placenta, but don't attempt to pull it out. What you're doing is you're allowing gravity to assist her. If the placenta has not passed within 24 hours, make sure you call your veterinarian. Next. So what's next for mom? At this point, she's going to be bonding with the kids. And so after birth, the ewes or the does immediately want to nudge and lick their babies. It may take a little longer for them to start nursing, but it's necessary that these lambs or kids have colostrum within the first 12 hours. Ewes or does who had a rough lambing or kidding may need some assistance. Warm water with molasses or some other glucose source can give them energy. And then they need a quiet space where they can bond with their lambs or kids. And first timers may need some assistance in figuring out what it means. I mean, you have some yearlings, some first timer 2-year-olds that they don't know what these little things are, and they're actually afraid of the lambs or kids. And so it may take a little assistance just to figure out what it means to care for these lambs or kids. Okay, and I'll turn it over to Robby now.
So now we've kind of walked through the birthing process. We've, mom's gone through all parts of labor. So what's next? Some things to kind of think about. Caring for our newborn lambs and kids in warm weather. You may not have to do any intervention at all. Probably don't need a lot of assistance, those kinds of things. Newborn care, especially for, I'm crazy enough, we kid out in the first couple weeks of January, typically is when I schedule for ours to kids. So, it's cold outside. It's, so in that cold weather, we want to help mom dry those kids if we can, get them clean. That's why you have some of those towels there. Summer months, if it's warmer, you don't really have anything to worry about. And we just need to make sure we clear their nostrils, those sorts of things. So sometimes depending on your operation, whether you're raising dairy goats, meat goats, or you're raising lambs, probably depends on whether or not how your kids are going to be raised. Are they going to be bottle fed, or are they going to be fed by the dam? So, making sure you follow those protocols, and you still want to monitor, determine, especially every day. We're down the barn a couple times a day, making sure our kids are up, they're nursing, those things, and if they need assistance. So I did have one of our kids this year that got a little too cold, and so we had to provide some assistance, get them warmed back up, because they're obviously not eating during that time. You need to make sure they get plenty of milk inside of them. So one of the things to kind of think about, is if you're going to nursing or bottle feeding, like Sara had mentioned, making sure we're getting plenty of colostrum in them within the first 12 hours. My rule of thumb is, within an hour, I always try to get them to nurse or drink, just so I know they're getting that colostrum. And so that really helps their nutrition system. And there's plenty of studies that will show you that they really need that within the first 12 hours inside their gut. Deciding whether you're going to bottle raise them, put them on a lamb bar, those kinds of things is really important to know beforehand. And it's always good, like we mentioned previously, to have a source of colostrum. What I do every year is we always end up having one that's going to have a single. I'll milk a little bit of that colostrum out, freeze it, save it to the next birthing cycle we have, just so I have some colostrum on place. You can use, the colostrum replacer you can buy in the store, but it's not near as good as the source itself. So care of weak lambs and kids. Just make sure if you're not comfortable consulting your veterinarian, just to get some ideas off of what could be happening. The first step is to make sure you clear off face, suction it out, making sure they're breathing right, making sure that making sure they're up with that. Check for heartbeat, those kinds of things, signs that we would look at in a human as well. because there's a number of reasons they could be weak. So just thinking about those things. One of the biggest things I can tell you is do not tube feed lambs or kids until they are warm and the correct body temperature. Tube feeding lambs and kids at an under normal body temperature will kill them. And so it's really important to make sure they're up to body temp and then to feed them if you have to tube feed them or get them to drink out of a bottle. So some other things to think about when we're caring for weak kids and lambs. If they don't stand within an hour, you want to make sure you hand feed them some colostrum. If they were stuck, if they will not suck on the mom or even on a bottle, you might need to tube feed them a small amount. Or what you could do to start that process is just take a little syringe, and kind of put it down on their tongue a little bit and try to get them to figure it out. Again, this is something your veterinarian might recommend is B complex and BOCI that you can use in weak kids, especially here in Indiana and across the Midwest. We're typically low in selenium and vitamin E in all of our feeds. And so this is something you can use to boost that kid or lamb to get them to be a little healthier. And you can also use Karo syrup under the tongue to help get that energy supplement up there that we talked about too. So here's just some tips on tube feeding that animal. This should always be the last resort of having to feed animals. I've been fortunate enough. I've only ever had to tube feed a few of them. It is always scary when I have to do this. It's nothing I like to do, but something that you have to do sometimes if you're trying to save that animal. One of the big thing is, again, making sure that animal is warm and correct body temperature. Make sure that the tube of the animal should reach the last rib. So you can buy these kits, and I always take that tube, making sure you kind of take it from the mouth all the way to how far does it reach, and it should reach to the last rib so it gets down into the stomach. You want to position the animal as seen below in the photos, so kind of putting that animal in between your legs there to kind of hold and restrain that animal at the same time, into making sure you can get that colostrum down the animal. The big thing is the animal should be easy to swallow the tube and don't force it. And so it should easily, gently go down. And you want to make sure you have the tube placed correctly. And so you can kind of look on the tube, and what I've seen some people do, and what I do is I will kind of take and blow in that tube a little bit to make sure I'm not blowing the lung and it's actually making the stomach expand just a little bit. And there is a publication there from the Washington State University Extension Small Farms team that has really good publication on tube feeding. If you've never tube fed before, my best advice is if you have someone that you might be close to that raises lambs or goats, have them come and help you. Or if you have your veterinarian help you do it the first time, because it's a delicate process. Making sure once you've got that tube correctly placed into the animal, attach the syringe to tube feed after it's fully inserted. Take the plunger and push it down, and it will be difficult to push down if it's correctly placed. If it's really easy to push that, this is kind of the other double check before you have fluids in there. If it's hard to push down, that means you're in the right place. If it goes like this, real easy, probably in the lungs, need to pull that tube back out and go back in and try again. And so it's really important to do that. If the tube is ready to go, you can start administering the milk and let gravity be your friend. Don't really force it a whole lot. Just be very slow during this process. And then there's just some more information of different websites and publications throughout universities. We have some at Purdue as well that you can check out about kidding and general management of goats and sheep. And so at this time, we will open it up for any questions you may have. You can put it in the chat, or feel free to unmute yourself and ask those questions. So we do have a comment from Alicia Rogers, who's one of our extension educators in DeKalb County. She said that I found that if I'm moving a group to a lamb bar, it is easier to bottle feed them first with the same style nipples than switching nipple kinds, which is really important to kind of think about as your process of raising those animals as they kind of get adapted to one. So that might be an easier trick for you to do.
Well, thank you all for joining us today, and I hope that you have a successful kidding season. Okay, I do see a question there. What do you do if a doe or ewe gets milk fever? So milk fever is calcium deficiency. And so giving an injectable calcium, and I would definitely work with your vet on that. And then we didn't get into the different metabolic diseases that can that are associated with late pregnancy, such as pregnancy toxemia. And again, that's a whole nother presentation. But milk fever, that is injectable calcium, and you'll need to work with your veterinarian on that. But thank you all for joining us today, and I wish you all a successful kidding and lambing season. So have a wonderful month, and we will see you back in February with the start of our quarterly webinars.